It's not the first time he's addressing us. Amos is the senior diplomatic correspondent with the Haaretz newspaper. He's been doing this for over 20 years. He is one of the most respected and leading defense analysts in Israel, as you can assume, over the last year, at least since February, March. He's also been covering the pandemic in Israel and around the world. He also, in his spare time, covers Israeli politics as well. So we have a full agenda today. Our main topic, of course, is the extraordinary rollout of the vaccine effort in Israel. Some call Israel now the vaccination nation. The numbers are really outstanding. And Amos, maybe we'll begin with that. Where is Israel compared to the rest of the world, just in terms of the sheer numbers, those over 65, those at risk, the overall numbers in the population, and what the projections are for full vaccination of the country? Thank you.
Hi, David. Thank you for inviting me. Well, as you said, we have turned into a sort of a vaccination nation. It's now over 25% of Israelis altogether who received at least one dose of the COVID vaccine. And since by the regulations of Pfizer, you could only vaccinate over 16-year-olds, it's practically more than 25% of the population, of the relative population. More than 2 million Israelis have received the vaccine already. And perhaps what's more important is that more than 75% of those over 60 who are more at risk to die or become severely ill from the virus were already vaccinated. So until the end of January, this group will get the second dose as well. Right now, the rate is around 150,000 people a day. They're hoping to make it 250,000 within a few days, and it's the number one national effort as we speak. Just from from my private experience, my personal experience, I just accompanied my mother, who's 86 years old, this morning in Jerusalem to get her second dose of the vaccine. And it was quite amazing to watch how quickly and how efficiently this was done. Within a week, she will be probably perfectly safe. And for us, it's the first time that she'll be able to hug her granddaughters and grandsons after a year. And since she lives in an assisted living community, which is practically the first place in Israel where the virus had hit last March, this is quite an achievement. So you can actually get to see this at work, and I was quite impressed. It was the second time within 3 weeks, and it worked out perfectly.
So Israel has vaccinated over 2 million people. The expectations are that those numbers will reach the majority of the 7 million that are over 16. At what date do you estimate, Amos?
Netanyahu, the prime minister, has announced that his goal is to have more than 5 million Israelis vaccinated by early March. This would be the majority of people over 16s. And he's also saying that he's hoping to to open up the economy by that time. At the background of all of this, of course, are the elections. And March 23rd, we're going to a fourth round of elections to the Knesset within 2 years. And Netanyahu himself, of course, is facing legal problems, the trial, and so on. And his whole campaign right now is focused on the vaccines. What he's practically saying is Israel, because of me and because of the vaccines, Israel is going to be the first country in the world to come out of this crisis. And therefore, he's actually saying to the voters, I deserve to stay, I deserve to get elected again, because I'm the only leader who is going to manage this in such a short time. There are other questions, of course, because as I mentioned, Pfizer regulates the vaccines only to over 16s. There are now trials done somewhere in the world about people between younger people, probably 12 to 16, and so on. The question is whether, if indeed we succeed in vaccinating the majority of people over 16, what do we do about the kids later? Because right now, as you know, Israel is under a third strict lockdown. Students are not going to schools, or kids are not even going to kindergarten. What do you do later? If the adults are all vaccinated and immune, what do you do about the kids? Do you continue the system of track, trace, and isolate, or do you say it's not relevant anymore because kids are hit rather easily by the virus? They can handle it, they hardly notice it, and therefore you shouldn't bother. You should just go ahead with the economy. The fear is, of course, that somehow we'd lose control, even if we succeed in vaccinating this huge number of people at such a short amount of time. There will still be a problem with the kids because somehow some people will still be ill, and there will still be a problem regarding hospitals and so on. This hasn't been decided yet. The government is sending mixed messages to the public about that, but I think mostly this is happening because this is so new. As I said, we're the first country in the world to deal with such a problem because we're ahead of most other countries while dealing with the vaccines.
And can you say a word, Amos, about the issue of herd immunity? So on the one hand, you say that 75% of those at risk have been vaccinated, but 25% have not. You know, there are 2.5 million Israelis under the age of 16, so they will not be vaccinated at this point. And you have a 95% efficiency rate on the vaccination, so that there is a segment of the population, some estimated hundreds of thousands, that are not vaccinated. Is it possible to reach herd immunity under these circumstances, and when you have the variants of the virus that are so violent right now?
David, I think not. It's not clear yet, and the math is not absolutely clear because, as I said, this is so new to everybody. And you've mentioned the new variations, the British variant, the South African variant. Now there's a Brazilian one mutation as well. All of these are, it seems troubling because their rate is so much higher than the original Chinese one. So some experts are saying that perhaps the actual level of herd immunity needed to deal with COVID-19 is perhaps over 80%, and you can't reach this this number if you don't start vaccinating kids. And we'll still have to wait for what Pfizer and Moderna, which is just now sending the first vaccines to Israel, is actually saying that this should be limited to 18-year-olds and over. So we will have to see. I think reaching herd immunity will take time. It's not the direct goal right now. This is mostly about vaccinating most of the adult population, changing, if you like, the course of the virus, reaching an R which is much lower than 1, and moving ahead, hopefully beginning to deal with the more successfully with the pandemic, and gradually easing the pressure on the hospitals. But this will take time. When Netanyahu speaks of March, it's a bit of an obscure goal. It's not exactly clear what he means and what would happen. For him, it's mostly about opening up the economy and, of course, winning the elections. But the details, the devil is in the details, and the details are not clear yet. And the fear is that somehow, in spite of our great success with the vaccination effort, that somehow we would lose control. And if you just look at the sheer numbers right now, every day since I think last Sunday, we've had about 8,000 to 9,000 new cases a day. Now, by Israeli standards, this is almost a record. This is quite high. And of course, the hospital system is having a very hard time dealing with that. We have around somewhere between 1,100 and 1,200 severe cases right now being hospitalized. This is a huge burden for the hospital system. And we have somewhere between 30 to 40 deaths a day. Remember, Israel is a small country, slightly over 9 million people. These are high numbers. We've also crossed a number that we hoped we would never reach. There are more than 4,000 Israelis who died. Now, when you compare that from COVID-19, when you compare that to the United States, which just crossed 400,000, then of course our number is much smaller, but still it raises a lot of questions, a lot of debate, and also some criticism towards the government because of the way it handled the crisis. That the vaccination effort, as we've said, a great success, and everybody's praising the government for doing that. But when we look at the past and what has been done and some of the decisions that were taken, then there's quite a lot to debate about.
Thank you, Amos. I want to ask a follow-up on the vaccines and the success, and then we'll move on to some of the other aspects of this. So, if you look at Israel compared to the international numbers, it really is mind-boggling. Israel, you said, is at over or around 25%. The United States, if I'm not mistaken, is at 3 to 4%. Maybe the UK is the only country in the Western democracy that's over 5% right now. How do you account for this vast gulf in the numbers? Is it something about Israel's background, history, the healthcare system, the digital nature of it? How do you analyze it?
It's perhaps a combination of all of the above. If I can, let me present the main reasons. One, as you said, is the actual number of vaccines that we've already been able to receive. This is somewhere around 6 to 7 million, I think, doses right now, and it will go up to 12 to 14 million, which are enough for 6 to 7 million people by probably by March. A lot of this had to do with the splits that Netanyahu maintained over the general managers of Moderna and especially Pfizer. He was, and I think he was right about that, he was absolutely willing to pay more for every dose than other countries. He did the math, and that's quite clear. Lockdown is much more expensive than paying more for the actual vaccines. And he was also willing, to some extent, to give them more information than other countries. There's a whole debate right now whether this hurts our medical privacy of the Israelis and so on. As far as I can tell, I don't think anything serious was breached there. But for those companies, especially Pfizer, it's a win-win situation. First of all, they get more information about the success. This is a huge trial. This is not the 40,000 people who took place in their international trial, but actually millions of people in a specified country who are now receiving their doses of the vaccine. So it's very important for them to learn about the implications of this and how successful their vaccine actually is. Secondly, they're able, through Israel, to present a success story. Already, judging by the numbers for the last 2 or 3 days, we're seeing for the first time that those over 60 who did receive the vaccine are more protected and there's less of a chance of them getting ill with COVID-19 because they've been vaccinated. So this is a huge success story, and this is exactly what Pfizer wants to present to the world right now. Look at the Israeli success. You need to do business with us. You need to sign contracts with us in order for us to supply you with the answer to this. So this is how Netanyahu has presented that to those companies, and he's been successful with that. On top of this, I think Israelis, in principle, have a positive attitude towards vaccination. There's been a lot of effort done to explain this to communities, and not only to people like you and me, but also to more conservative people or people who are less interested or understanding about science development and so on. We've seen ultra-Orthodox rabbis and we've seen celebrities who are part of this effort to explain this to the Israeli population. There's another issue here. I think I'd call it the Israeli version of FOMO, fear of missing out. One of the concepts that every Israeli knows is how not to be a flyer. A flyer is a Yiddish term, how not to be a sucker. And once everybody else is getting the vaccines, you wanted this as well. And if you can push ahead, and that is even more preferable, if you can get it before everybody else, then this is great, even if you don't necessarily deserve it at this time. So we've seen for the last few weeks, people attempting to get vaccinated by any means necessary. I'll tell you another story, don't quote me on this. My 17-year-old son has already managed to get his first dose. He didn't break any rules. We live in a small town near Tel Aviv. At 8 o'clock, somewhere around 8 o'clock in the evening, they spread the word that they still have vaccines and people can come and volunteer and take them because they don't want to be wasteful. They want to use each and every dose of this. So my son, who is an avid soccer fan, is very, very afraid of the possibility that in 2 months' time, when the crowds are already will probably be allowed to watch football again, he would not be allowed in if he's not vaccinated. So he did everything he could do, and of course, within 2 days, he managed to get his dose of vaccine. So the same thing is happening all over Israel, and this fear of missing out is quite a thing right now. On top of this, I have to mention the fact that the logistics is quite easy. I mean, it's a small country. The warehouses where the vaccines are kept are about a 3-hour drive from everywhere. This is very, very different than trying to deliver, I don't know, vaccines from New York to Wyoming to Nevada and to New Mexico. There are so many different places and so many flights you need to take. In Israel, it's quite a short way to drive. And on top of everything else, I have to give a credit to our social democratic background, the founding fathers of this country. This is the one time where this is actually working for our better good. The fact that Israel traditionally has a system of health maintenance organization is very, very helpful, because every Israeli is connected to one of those 4 HMOs. They have doctors and nurses everywhere. They collect huge amounts of information, and they're qualified to contact with us directly. Everybody has an app on their phones where they can actually not only be in contact with their HMO, they can actually order a time to get your vaccines. Again, if you're under 40, you have to wait. But still, as I said, as I mentioned the story with my kid, if you have the opportunity, you can use that. And people who are really, really anxious to get vaccinated have already received at least their first dose. So this is quite successful. This is very different than other countries. But for once, I think we can be grateful to that system, because it turns out that in 2021, it's actually working in our favor. This is very, very important. And finally, I think it also has to do with the fact that we're quite good as Israelis with short-term challenges. We're very good. Look at our wars. We're very good when everybody needs to become part of the national effort. We're not as good when we need to keep discipline and organization and order and so on for a year. And this is why we're doing so badly when we're talking of of dealing with the crisis itself, with trying to restrain the pandemic from the COVID-19 from spreading. But when it comes to short-term efforts, and when you need the whole country, the whole society to get enlisted, so to speak, as part of that effort, we're pretty good at that.
Thank you. Please post your questions on the chat. Amos is a rare opportunity to discuss not just this issue, the vaccines, and obviously the impact on the political situation in Israel, but also he's, as I said earlier, one of the leading defense correspondents in Israel. Can we all please remain on mute? Thank you. So it's a terrific opportunity to discuss some of the global issues that we face, but we're going to continue where we are for a few more moments. And I have a question, Amos, about the international implications of this. So there's tremendous interest in other countries about the lessons learned from Israel. Last week, we had a briefing in the French Parliament. Tomorrow, I see Marta, our Polish director, who's on the call with us right now. There'll be a major event in the Polish Parliament regarding this issue with one of Israel's top experts in the field. What are the lessons learned for other countries, and what can Israel do with other countries to increase cooperation on vaccines and digital health and so on?
Look, our case is probably slightly different than other countries. And I mentioned that the historical background, the way we deal with short-term challenges, the fact that this is a small country with relatively a small population compared to some other countries. But I do think that Israel has some lessons it can teach the world regarding vaccinations. The operation hasn't ended yet, but the fact that we've been so successful in the last 3.5 weeks is something that other countries could learn from. I know that the British government already has been in contact with the Israeli health ministry in order to learn some of the conclusions. I assume that other countries would do that as well. I'm not so sure about the European Union, but maybe considering the fact that not enough vaccinations have been delivered already, they should speak to the Israelis as well. This is the rare case, not the rare case, but there are cases in which Israel is ahead of the world. And we've talked about this before we started the whole session between you and me. It's quite interesting, this paradox between how well we've dealt with the vaccination effort and this and how badly we dealt with the crisis itself until now.
Another international implication, Amos, is the claims on the Palestinian issue. So while Israel is enjoying these tremendous rates, there is a campaign that we see that is a very poisonous campaign internationally, that the Israelis are obviously vaccinating themselves and the Palestinians continue to suffer. Can you talk a little bit about the region and specifically the Palestinian dimensions of this, and how damaging is that to Israel's reputation, since we hear it so often these days?
Okay, so this is quite a dilemma. I think in the end, I would assume that the Palestinians would get vaccines, probably the Russian and Chinese made, probably with some help from the Gulf states, and I would assume that this would begin happening sometime soon, within a few weeks or maybe a short number of months. As you mentioned, there's a whole debate going on, both internally, but especially on the international community. Is Israel responsible for residents of the territories, whether it's Gaza or the West Bank? Israel is saying, according to the Oslo Accords, they're responsible to their own health, and this is something that they should deal with. The problem is, it's a two-phase problem. One, if there are no people vaccinated in the West Bank, it would be very, very hard to contain the spread of the virus, because, as you know, and as most of the people who are listening in know, there's no strict distinction between Israel and the West Bank. People are moving back and forth all the time, not only Palestinians, but also Jews, whether it's soldiers or settlers and so on. And we have tens of thousands of Palestinians who are working, whether it's East Jerusalemites who work in West Jerusalem, or people building houses, apartment buildings, and so on in Tel Aviv. So those people are among us, and if they're not vaccinated, it will make it very, very hard to stop the spread of the virus. Both populations are close to each other. They keep in close contact, and it's hard to contain the spread of the pandemic without dealing with this as a whole issue. This is regarding the West Bank and East Jerusalem. Gaza is another story, and as you know, Ariel Sharon's decision to disengage from the Gaza Strip and to destroy the settlements, more than 20 settlements there in 2005, meant that Israel has evacuated all of its forces and all of its citizens from Gaza. The problem regarding Gaza is slightly different. It doesn't have to do, in my view, with moral issues. It has to do with practical issues. If Israel is safe from the pandemic, and if most of the Israeli population is vaccinated, and we see the pandemic gradually withdrawing, so to speak, from Israel, what happens in Gaza? And isn't the frustration and the anger among Hamas leadership, isn't there a danger that this would lead to some new rise in violence or some new conflict with Israel? For the time being, there have been hundreds of deaths in Gaza, but Hamas, which is of course quite brutal towards its own population, has been relatively successful at containing the virus. But if this continues to spread, and you see a situation in which Israel gets its share of vaccines, even the West Bank has its own solution, and Hamas and Gaza are left behind, this may be dangerous for Israel as well. So in my view, this is why Israel has an interest to vaccinate them, perhaps not the top of the agenda, but it should happen quite soon, because we rely on each other. You cannot separate completely between Israel and the West Bank, and even this can be done even between Israel and Gaza. I think you're right. Israel has a problem of image regarding this, and I think some of the resentment you hear right now, some of the reasons why some European countries are not that enthusiastic about the Israeli success is exactly this issue. Whether it's their actual reservation about reservations about the way Israel treats its territories, or whether it's used as an excuse in order not to give Israel credit, I don't know. But the end result is that whenever you bring up the Israeli success, people will tell you, yes, but what about the Palestinians? So even from a PR point of view, Israel needs to solve this, and solve this fast, because it will help its image abroad. And if it remains a problem, it would become more and more an issue for anti-Israeli propaganda, in my view.
Thank you. Amos, the region, the Abraham Accords, the Gulf countries also facing similar dilemmas, but also having big vaccine successes, UAE, Bahrain. Do you see a potential of cooperation there between Israel and the Middle East on this issue?
There's already been some cooperation, and when open negotiations happened during August and September, it was quite clear that those countries were seeking Israeli help regarding handling the pandemic. There was even, I think, the general director general of the Ministry of Health went to Dubai to have discussions and to sign agreements with its counterparts at the UAE. And Israel is perfectly willing to help those countries with its information. Of course, in the case of both UAE and Bahrain, the fact that they are successful at vaccinating has to do with two reasons. Again, small countries and very, very wealthy. So it was no problem for them to secure a few million doses in order to deal with their population. Even saying that, I think as far as I can say that the last time I looked was yesterday, Israel was still way ahead of the curve when it came to the actual number, the actual percentage of the population that has been vaccinated already.
And can you say a word or two about the whole concept of green passports, people who have received their double vaccination? Will Israel be one of the first to actually emerge out of this in terms of people being able to move both in the country and internationally?
Hopefully, yes. The concept is not yet clear. There have been indications both by the Prime Minister and the Minister of Health that this would happen, that there will be green passports, and that perhaps quite soon they'll try to reopen entertainment events, sports events, and so on. I don't know how successful this will be, and this still relies on what happens with the actual effort to contain the virus, about the spread of the pandemic. Right now, with 8,000 to 9,000 cases a day, this seems like science fiction. But if indeed the combination of the third lockdown and continuing the effort regarding vaccinations work, then probably by March, we will have a chance of opening more and more events internally. About what would happen outside of Israel, this is still more complicated and it's still rather obscure or vague. We don't know yet. Last summer, when there were several European countries that were not hit as badly by the pandemic, for instance, Greece and Croatia and so on, there were all kinds of short-term agreements that allowed Israelis to fly as tourists to places like Greece without needing to
without quarantine.
Without quarantine. I'm not sure this would be possible considering the level, the rate of the virus is spreading right now all over Europe. I would, and the US. My guess is that sometime around the summer, both Israel and perhaps many European countries would be able to turn the page and would be beginning to recover from this huge crisis. And then there will be more discussions about tourism, green passports, and so on. About the United States, I have to tell you, I haven't made any plans about visiting the States in this summer, and I would assume that most Israelis would rather wait and see what happens. It's sad to say, but the difference between the way Israel and other countries are handling this crisis and this huge challenge and what happened under the Trump administration recently, it's quite huge, and it's quite sad to watch from here to see what has happened to the greatest nation in the world while dealing with this challenge. This is, it's quite troubling to watch from here.
Regarding the United States and the change in administrations, do you see a change in policy? Are you optimistic about the Biden administration's people coming in terms of the way they will be handling this crisis in the United States?
Look, I would assume so. I wouldn't want to get carried away with too much optimism, and there's always a chance that I let my personal beliefs or ideology interfere with my analysis of the situation. But I don't think that I don't think that this has to do too much with an ideological debate to say that the current administration, the outgoing administration, has failed dealing with the pandemic. The problem was, more than anything else, was that this became a political issue for the United States. And even the smallest act of solidarity, meaning wearing a mask, became a huge political obstacle, and people were willing to fight each other to death over such an issue. I see some resentment regarding vaccination as well. So it will be problematic for the United States. On the other hand, what President-elect Biden has been saying for quite some time, I see him tweeting it on a daily basis, is that he will ask Americans to wear masks for the first 100 days, and that he would spread vaccines as quickly as possible, and so on. And I would never underestimate the United States capabilities in the end. When it deals with huge logistic challenges, technological challenges, and so on, it's the leading power in the world. I would assume that somewhere between spring and summer, the administration would get hold of the problem and would start dealing with this more quickly. But then again, being such a huge country, I'm afraid that it will take more time. But I don't think we'll see anything like what we've witnessed during the last summer, that those events where they were spreading COVID like crazy. Those events where people around the president were saying that there was not really a pandemic, and so on. We'll see nothing of that kind within a few days. And for me, as somebody who's looked up to the United States for so many years, this is encouraging, I think.